Good morning, everyone. Today, I'm going to present results of our study where we looked at the impact of COVID-19 pandemic on people and children with CF and their families. This is a study conducted jointly between UCD and Cystic Fibrosis Ireland, the support and advocacy organization for people with CF. I am a PhD student funded through a grant from Health Research Board. A self-administered questionnaire developed by UCD and Cystic Fibrosis Ireland was hosted and advertised by Cystic Fibrosis Ireland to the CF community by their website and social media in the months of October and November 2020. The total number of participants was 242, 119 were adults with CF and 123 were parents of children with CF. Looking at the table on the top left, 47.5% of PWCF and 55% of children had visits deferred during the pandemic. Looking at the figure on the right, the majority of children had a deferral for 3 months and majority of adults had a deferral for 6 months or above. The figure below left shows the key reasons of deferral, which were fear of COVID-19 and closure of hospital unit. This slide looks at the medical care of PWCF during the first year of pandemic. The column graphs at the top row shows the numbers and the cluster bar shows the experience, from very useful to not at all useful. First, looking at the top left, online consultations were new to around half of the population and majority of them found it helpful for them. Looking at the second bar above, overall around 53% of them received their prescriptions via email and those who did, more than 80% found it beneficial for them. The third and the fourth bar shows that relatively smaller number of adults used online education or online physiotherapy classes and those who did found it really helpful. This slide looks at the medical care of children with CF during the first year of pandemic. The slide is set out in the same way as the last one. First, looking at the online consultation on the children, on the top left, we can see online consultation was new and some parents found it helpful for them. Looking at the second bar above, overall around 55% of parents received their child's prescription via email and those who did, more than 80% found it beneficial for them. The third and the fourth bar show that a smaller number of parents and children used online education and online physiotherapy classes, but those who did found it really helpful. We did not find any significant differences between adults and children with regard to consultation results. We looked at the availability of medicines and PPE and found that 13% of parents of CWCF and 30% of PWCF found it challenging to access medicines or treatments for cystic fibrosis, of whom one child with CF and 7 adults with CF had to stop taking medicines and had to find an alternative. We found that most were happy with the availability of PPE and use of hand sanitizers. This slide looks at the impact of COVID-19 on mental health. The graph on the left shows that 74% of adults experienced issues related to mental health during the pandemic. 71% of children with CF were deemed by their parents to have suffered issues related to mental health. Looking at the graph on the right, the key mental health issues by both adults and children were increased anxiety and stress. After adjustment for gender and work, younger adults were 3 times more likely to have negative feelings. Overall, delays in hospital visits is of great concern as routine examination is the key to early intervention in infective exacerbations or picking up of any other signs of clinical deterioration. Prescription via email was also popular. COVID-19 pandemic also had a serious impact on mental health of adults with CF, children with CF, and their parents. Finally, I would like to thank those who participated in the study, Cystic Fibrosis Ireland and Health Research Board. Thank you.